Hi, how are you doing? In today's video, I want to show you how to relieve pain on the inside of your knee, usually associated with the Pes Anserinus. If you don't know me, nice to meet you. I'm Dr. Alexandre Mota. I'm a physical therapist and osteopath, and it's really good to have you here. Take a look at this question. Marcelo asked, "Hi, good morning. What exercises can I do to relieve the pain from Pes Anserine syndrome?" The first thing is for us to understand what the Pes Anserine area is. What this inflammation in the goose foot is, which we call Pes Anserine tendinitis, and how to identify it, how to tell whether we have it or not. I made a quick drawing here for you to understand. Let's go. Look. In blue, I have the bones. This one down here is the shin bone. This bone on top, which is the thigh bone, the femur. So here is the knee, and here is on the inside. There are three black lines. They are three tendons, that is, three muscles that go to the same place. And the arrival of these three tendons, of these three muscles at the knee, is what is called the Pes Anserinus. Cool. Pretty crazy.
And Alexandre, how am I going to know if this Pes Anserinus area is inflamed?
It's super easy. There are 5 signs of inflammation. We know that a part of our body is inflamed when it hurts. When it's red, when it's hot, hotter than other parts of the body, when it's swollen, and when it gets worse with movement. So if in this region here, look on the inside of the knee or near it, you feel pain, notice swelling, feel sensitive to touch, hot, red, and these symptoms get worse. When you move your knee more, when you walk more, go upstairs, when you stand all day or do some physical activity. It's very likely that this area, which is the Pes Anserinus, is inflamed. Now I want to tell you something really cool that not many people think about when talking about or treating the Pes Anserinus. I told you that there are 3 muscles that make up the Pes Anserinus: the sartorius, the gracilis, and the semitendinosus. But look how cool this is. These 3 muscles, they come from the pelvis. These 3 muscles come from different directions. This one on top, the sartorius, it comes from the front part of the thigh. This one in the middle, the gracilis, it comes from the inner part of the thigh. And the semitendinosus, this one below, it comes from the back of the thigh. It got complicated. So here you see my knee, the inner part, the shin bone, the tibia, and here on the inside coming out, the 3 tendons of the 3 muscles that form the Pes Anserinus. The first muscle at the top is the sartorius, which comes from the front of the thigh. The one in the middle is the gracilis, which comes from the inner side of the thigh. And the last one is the semitendinosus, which comes from the back side of the thigh. So, any imbalance in the pelvis affects the knee, mainly in the Pes Anserinus. In other words, if you have inflammation of the Pes Anserinus and it seems like nothing gets better, nothing really solves it, it's an inflammation that keeps coming back. It's very likely that this tendinitis, this inflammation, is being caused by imbalances in the pelvis, in the pelvic area. Hey, that's pretty good. By the way, I'm leaving a video here in the card where I show how to improve pelvic balance and, in your case, consequently, help your Pes Anserinus issue. And if you still have any questions about the Pes Anserinus, another knee pain, or any other pain in your body, leave your question here in the comments. If you want to ask about a pain you're feeling, try to give me more details. Where does it hurt? How did this pain start? What makes this pain worse and what makes this pain better? The more details you give me, the more I can help you, and I can even make a video answering your question just like this one. And to make sure you don't miss the answer, of course, subscribe to the channel, turn on the notification bell, and select all notifications. Because then when I answer your question, YouTube will let you know there's a new video. So let's go to the first exercise now. This exercise is great, especially when you are in the acute phase in an active Pes Anserine flare-up. In other words, on those days when the Pes Anserine area is inflamed, when it's hurting more, when it's red, it's tender to the touch. It's on those days that you need to do this first exercise. So, let's go. First, find where the Pes Anserine area is. An easy thing for us to start looking at is the patella itself, the kneecap. this big triangle that's in front of the knee, from the patella right here below. You also have a part, a little tip of bone, called the tibial tuberosity or anterior tibial tuberosity. And right next to the anterior tibial tuberosity, you're going to look for a tender spot. Go slowly, because as I said, it's inflamed. It can be very painful. So find the worst spot, and that's where you're going to work. And now that you've identified the most sensitive spot, you're going to bless the spot. What? Yeah, make the sign of the cross. I'm joking. You'll do it this way. So imagine that this X here is the spot I found. That's the worst spot. With the pad of my finger, I'm going to place it against the skin. And I'm going to pull the skin upwards. I wait 30 seconds. Then I pull the skin down. I wait 30 seconds. Then I pull the skin out. I wait 30 seconds. And I pull the skin in. I wait 30 seconds. Then, at the painful spot, I'm going to make a cross. Pull up, down, in and out, holding for 30 seconds in each of these positions. Now that you know how to relieve the pain, I'll show you 3 exercises. Each one is meant to bring more balance and relaxation to each of the 3 muscles that form the Pes Anserinus. So the first exercise is to improve the sartorius muscle, this muscle that comes along the front part of the thigh. So let's go. Here I am sitting. You're seeing almost from my point of view. Here on the inside, as I showed you from this region, the 3 tendons come from here. To work the sartorius muscle that runs along the front of the thigh, you have to imagine a line that goes from the Pes Anserinus all the way across the front of the thigh, crossing the thigh. And then, with the help of a little ball like this one that has these bumps for massage, you're going to roll it on the skin along the front part of your thigh. Alexandre, I'm not sure if I'm in the right spot. You don't need to be that precise. You can work along this whole line, work the entire front part of the thigh. The massage with this little ball helps improve tissue mobility, loosening the tissues, especially helping the skin move more freely over the muscles. And it helps bring more blood to these muscles. In other words, it helps relax these muscles. So you can work on all the muscles at the front of your thigh without any worries, without any problem. Do this massage up to where it feels comfortable. You don't need to press too hard to cause pain for about a minute. The second exercise is to help the gracilis, this muscle on the inside of the thigh. To work the gracilis, this muscle that runs along the inside of the thigh, it's simple too. The gracilis is the adductor muscle that helps bring the leg inward. And it's part of a group of muscles that do the same thing. Since I can't identify just one muscle, we're going to work on the gracilis by looking for sensitive points, trigger points on the inside of the thigh. So you can press from top to bottom looking for more sensitive spots. Take it easy because it might be quite painful. If you find a more sensitive spot, you keep the pressure. Try to relax your leg well and wait here for 90 seconds, a minute and a half. When the pain starts to decrease, you can even start moving your leg, bending and straightening it. You can look for 3, 4 or 5 trigger points or sensitive spots in this area. Remember that the pressure should cause only mild pain. If you're pressing and it's hurting a lot, press less, ease up a little. It's not about pressing too hard and hurting yourself. That will make it heal faster. And the third exercise, of course, is to work on the semitendinosus, which runs along the back of the thigh. And to work the semitendinosus muscle, the one that runs along the back of the thigh, here's what you're going to do. If you put your hand here behind your knee, you'll feel some tendons. One of those tendons is the semitendinosus tendon. So you'll hold it like this, as much as you can. Put your fingers behind your thigh and the palm of your hand on the side of your thigh on the inside. You're going to squeeze. If it hurts, wait for the pain to subside. As soon as the pain subsides, you move your leg, bend it, stretch it. You don't need to bend or stretch it completely. Stay here for about 30 seconds. 30 seconds have passed. Move up one hand's width. Wrap your hands around the back and middle of the inner thigh. Squeeze. Wait for the pain to subside and keep moving until you reach 30 seconds. Then, if you still can, move up another hand's width. Press. Wait for the pain to subside and keep moving for another 30 seconds, and I'm leaving the link to the Ciao do Dono Joello method here in the description. It's an online program where I talk about the main knee problems. There's even an entire module on the Pes Anserine area about pain on the inside of the leg. If you want to know how to improve your pelvis, bring more balance to your hips, work these muscles in different ways, work on the nerve that carries the pain sensation from the Pes Anserine area, then click the link in the description to get more information. Or even today, join the Ciao do Dono Joello method. And now I want to know if the video helped you. Did you learn something new? Thank me by clicking the like button down below. Your thumbs up helps you, helps other people, and helps our channel grow. And this channel, it's ours. So I want you to use these tips and all the other tips here on the channel to help those who are in pain. In fact, in the video description here, there's a link to all the playlists. Dono Joelho, Dono Coelho, hip pain, tingling in the hand, tingling in the feet and legs, back pain, lower back pain, neck pain, and many others. And up here I left a video that shows the best way for you to go upstairs without feeling pain. Just click and watch. And down here, there's a whole playlist about knee pain. If the video is there, it can help those who have knee pain. I'll stop here, big hug, and see you next time.